In this video, we're going to look at an example of a good e-consultation utilising the principles of efficiency that we discussed earlier. Throughout this video, what you're going to see is the thought process that goes into looking at an e-consultation before then contacting the patient. In this case, it's a 35-year-old male. He's had some back pain and wants some decent pain relief, and he wants to try and help himself, but has failed, and he's in a lot of pain. It's been going on for a while, and he did it at work lifting, and there are some symptoms of some nerve root pain. There are no red flags, and no significant past medical history. And if we look in the notes, there isn't anything significant here either. There's nothing in his problems list. No recent medications. What we need to do now is have a think about what we're going to do with him next. Clearly he needs something, but he needs some form of conversation to discuss it. It's probably too early for physio, and we've got most of the information you need. It's low risk, and an examination is going to add very little. It's unlikely they're going to be able to make it to the surgery anyway, given the amount of pain that they're describing. Looks like the best option here is to give the patient a call to go over the options and get a little bit more information. But you have most of the information already, so this should shorten the call considerably.
Hello.
Hi there, is that Mickey?
Hi, yes, it is.
Hi Mickey, it's Dr Dyer-Smith here calling from Practice X. I'm just responding to your online consultation you sent in this morning.
Oh, thank you so much. That was quick.
Good, yeah, no, that's how we like to do it, as quick as possible. So, I just want to confirm a few things about just your ID. So, can you just confirm to me your date of birth?
Yeah, it's 5th of March, 1983.
And your address?
1 Mousetrap.
And your email address?
It's mickey@disney788.com.
Okay, great. So look, I've gone through your details in your notes and on your online consultation, and I'm presuming nothing's much changed from when you've submitted it. Is that correct?
Oh, yeah. That was only an hour ago, so no, nothing has changed since then.
Okay, and you've tried a few things that haven't really worked, and you've got a bit of pain that's going into one of your legs. Is that right?
Yeah, I tried those painkillers, but it just doesn't seem to be touching it really.
Fine, okay. Have you thought about work? I'm presuming that's out of the question.
Yeah, I'm on the couch at the minute, and to be honest, I don't think I'd be able to cope at the minute.
Okay, so look, I think having read all that stuff and what you've just said to me now, I think the plan of action would be, I'm going to give you some slightly stronger painkillers, a treatment called naproxen, which is a bit like a kind of much more powerful version of ibuprofen. I can send that to the pharmacy next door to you, which I can see is about 100 yards away. So I'll send it electronically, and hopefully you can get someone just to pick that up for you and run it up to you. I think, given work, I think you're going to need a couple of weeks off work. So I'm going to do you a sick note, and I'm just going to email that to you if that's okay with you.
Oh yeah, of course. Yeah, okay. By all means, that's brilliant. Thank you.
The only thing you need to be aware of about sort of emailing is that we use a secure email service in the NHS. As soon as it's left our account and gone to an address such as yours, it's not secure. I mean, the risk is low, but you do need to be aware of that. Are you happy with that?
Oh, no, that's fine. I don't mind. Yeah, by all means, send it by email.
Fine, okay. The other thing I'm going to send you is a message with a link to an NHS Choices webpage, which basically tells you about back pain, how you can handle it yourself, and the things to look out for if it worsens.
Okay, yeah.
Okay, so having a read of that's very, very useful. And basically what you need to be aware of is if your pain's not controlled, you can get back to us in a couple of days via the eConsult platform again, and we can pick it up if we need to do a bit more with your pain relief. The things you need to be really sort of alert to is what's written in the NHS Choices section, and these are things like loss of sensation around your tail end, loss of control of your bladder or bowels. If those things happen, it's a job at hospital, but it's incredibly rare, and I think in your case it's pretty clear that this is a triggered event from you lifting something, and hopefully we can get it settled down. Okay.
Yeah, no, that's brilliant. Thank you very much.
Do you have any questions for me before we sign off?
Let me just think. So prescription to the chemist, sick note and information by email, and then if things aren't getting better, I'll just submit another online consultation. Perfect.
So, I hope you get better soon. Okay.
Thank you so much for getting back to me so quickly. I really appreciate it.
You're very welcome. Take care. Bye-bye.
Best. Bye.
So that consultation's gone very well and very efficiently. Now we've got to document it and hopefully stick to that efficiency rule. So here we go, using a template. A template means that you can put in the reason for the consultation. You don't need to write it out in its entirety because most of the information is actually in the e-consultation itself. Obviously, there's a place for where you can select and put in codes, and you can essentially just search for that with the first few letters of it and pick a code that's relevant to the condition or you feel fits it best. There's also an outcome code box, which is really useful for monitoring, and there's also a box below for documenting what's been said. If you've telephoned the patient, this is really useful to let any following clinicians know what actions and outcomes that you've actually achieved. You just save that in the notes. There is a quicker option where you can actually get to the template just from the top screen here by saying add data using template, same process. That's just a quicker way rather than opening a consultation. We hope you found that consultation enlightening, and we will be looking at some other common online consultations in their entirety.